The U.S. healthcare system stands at a critical juncture in 2024. The upcoming elections hold significant weight. They could reshape the healthcare landscape as we know it. The Affordable Care Act, a landmark achievement, faces an uncertain future. Republican challengers are ready to introduce their own reforms. All this unfolds against a backdrop of emerging health threats. The outcome will have profound implications for all Americans. The stakes are high. Millions of Americans rely on the ACA for health insurance. Its potential demise or alteration sparks both anxiety and hope. The future of U.S. healthcare hangs in the balance. The decisions made in the coming months will resonate for years to come. The 2024 elections hold the power to dramatically reshape the ACA. Republicans, if victorious, have vowed significant reforms. They aim to dismantle key provisions of the ACA. Their goal is to replace it with their own vision of healthcare. Democrats, on the other hand, stand firm in their commitment to protecting and expanding the ACA. They argue that it has been instrumental in expanding coverage and improving affordability. The outcome of the election will determine the ACA's fate. A Republican victory could mean a significant overhaul of the healthcare system. A Democratic victory, however, would likely preserve and potentially strengthen the ACA. The future of healthcare access for millions hangs in the balance. The election results will have a direct and immediate impact on the lives of countless Americans. Republican lawmakers propose a departure from the ACA's framework. They champion alternative approaches like high-risk pools and block grants to states. High-risk pools would separate individuals with pre-existing conditions. They would receive coverage through separate, state-managed pools. Block grants, on the other hand, would provide states with fixed sums of money. They would have more autonomy in designing their own healthcare programs. Proponents of these alternatives argue that they offer greater flexibility. They believe it empowers states to tailor healthcare to their unique needs. Critics, however, raise concerns about potential consequences. They fear that these changes could increase costs for older and sicker individuals. They also worry about potential reductions in essential health benefits. The debate over these competing visions for healthcare is likely to intensify. The outcome will have a profound impact on the lives of millions of Americans. Despite facing constant challenges, the ACA has witnessed a surge in popularity. A growing number of Americans now view it favorably. This shift in public opinion can be attributed to several factors. The ACA has successfully expanded health insurance coverage to millions. It has provided crucial protections for those with pre-existing conditions. Moreover, it has played a vital role in slowing down the growth of healthcare costs. The ACA's rising popularity presents a significant challenge for Republicans. Their efforts to repeal and replace the ACA have become increasingly difficult. Public support for the law has made it a much tougher political target. As the 2024 elections approach, the ACA's popularity is likely to be a major point of contention. Democrats will undoubtedly leverage its popularity to their advantage. Republicans, on the other hand, will need to grapple with the political risks of dismantling a program that now enjoys significant public support. Section 5. Marburg virus, a new threat on the horizon. As if the political battles over healthcare weren't enough, a new threat emerges: the Marburg virus. This deadly hemorrhagic fever, similar to Ebola, has caused an outbreak in Rwanda. The CDC, in response, has issued interim recommendations for U.S. healthcare workers returning from the affected region. These guidelines emphasize the importance of vigilance. They aim to prevent the virus from gaining a foothold in the U.S. The outbreak serves as a stark reminder of the ever-present threat of infectious diseases. It underscores the importance of a robust public health infrastructure. A well-prepared healthcare system is crucial for responding effectively to such outbreaks. The CDC's rapid response reflects the seriousness of the threat. The situation is being closely monitored. Healthcare professionals are on high alert, ready to act swiftly to contain any potential spread. Section 6. CDC Guidelines Protecting Healthcare Heroes. The CDC recommendations for healthcare workers returning from Rwanda are clear and specific. They call for daily monitoring for symptoms. A 21-day work restriction is also in place. This applies to personnel who were exposed to facilities with known transmission risks. These measures, while cautious, are essential. They aim to protect both healthcare workers and the public. The CDC's guidance underscores the critical role of healthcare workers. It also acknowledges the risks they take, especially during outbreaks. The guidelines prioritize their safety. They also aim to prevent further spread of the virus. The situation is fluid, and the CDC is committed to providing updates as it evolves. This proactive approach is crucial for staying ahead of the curve and effectively containing the outbreak. Section 7. The Health Czar Debate. A controversial figure emerges. Adding another layer of complexity to the U.S. healthcare landscape is the potential appointment of Robert F. Kennedy Jr. as the health czar in a second Trump administration. This possibility has ignited a firestorm of controversy. Kennedy, known for his outspoken views on vaccines, has become a polarizing figure. His potential appointment raises concerns about the direction of health policy under a second Trump term. Critics, particularly within the scientific and medical communities, have expressed alarm over Kennedy's stance on vaccines. They argue that his views are not supported by scientific evidence. They worry that his appointment could undermine public trust in vaccines. This, they fear, could have serious consequences for public health. The debate over Kennedy's potential appointment highlights the intersection of politics, science, and public health. It underscores the importance of evidence-based decision-making in healthcare policy. Section 8. Kennedy's stance on vaccines, fueling the fire. Kennedy's views on vaccines have drawn sharp criticism, particularly from Democrats and public health experts. He has repeatedly promoted the debunked link between vaccines and autism. He has also questioned the safety and efficacy of vaccines in general. These claims have been widely debunked by the scientific community. There is no credible evidence to support them. However, Kennedy's views have gained traction among certain groups. His supporters view him as a champion of individual liberty and a challenger to the medical establishment. Critics, on the other hand, see him as a dangerous purveyor of misinformation. They argue that his views pose a serious threat to public health. The controversy surrounding Kennedy's stance on vaccines is unlikely to subside anytime soon. It is a stark reminder of the challenges in combating misinformation and ensuring that public health policies are grounded in science. Section 9. The Road Ahead. Navigating the Future of U.S. Healthcare. The year 2024 promises to be pivotal for U.S. healthcare. The outcome of the elections, the fate of the ACA, and the potential appointment of a controversial health czar all loom large. The decisions made in the coming months will have far-reaching consequences for all Americans. Navigating this complex landscape requires careful consideration of the competing perspectives and potential ramifications of policy choices. One thing is certain, the U.S. healthcare system is in flux. The path forward remains unclear. What is clear, however, is that the stakes are high. The health and well-being of millions of Americans hang in the balance. As the nation grapples with these challenges, it is imperative that decisions are made with the best interests of the American people in mind. The road ahead may be uncertain, but the pursuit of a more equitable, accessible, and affordable healthcare system must continue.